listen, I think we're going to continue to see more and more artificial intelligence and not just, mathematical methods and models, but I think where we're going to see the innovation there is, how can we take the sophistication in some of that math and really get it into workflows and put it at the fingertips of your knowledge workers.
In part one of our conversation with Dave Billiter, he told us about how his experience as the head of innovation at Nationwide's Children's Hospital inspired him to found DeepLens, a company aiming to help patients find clinical trials using artificial intelligence. In the second part of our conversation, Dave talks about the difficulties he's faced finding healthcare administrators willing to change their established methods and how to scale in such a challenging market where so much is at stake. Dave, I'm excited to have you back again and dig into more. How are you innovating? How are you growing and overcoming challenges? Because I'm sure you've had your face of challenges.
Sure, absolutely.
So this idea began, you said, about 3 years ago. How did you really get it started? Like, where did the idea, and then how did you grow that seed into where you are?
Yeah. No, thank you for the question, Alex. I would say just the idea really came from, I would say, years of just even my background and seeing, a number of different challenges when I was the director of informatics at Nationwide Children's Hospital in Columbus. And then even into my time at Cardinal Health, really looking at challenges from data perspectives, looking at operational challenges and trying to get patients on clinical trials. It was really that, I would say, pulling all that reference from my time in that space. And then even working with my two partners, TJ Bowen and Simon Arkell. Those are my two partners that I brought to the table to really start this company, and with their backgrounds and us really digging into the problems, within the market, but also even, I would say, business challenges with pricing structures and business models. All three of us came together, and that's really what created really the drive to create DeepLens.
You're a VC funded, right? You're VC
Correct.
backed. How do
Correct.
you go from that idea? We see a problem. I got some people. What the heck do we do with this?
No, I think, so we're based here in Columbus, Ohio. I think we're fortunate to have a community here that aids in, startup businesses. And, one of the groups here in town, Rev One Ventures, they were really beneficial and really helping understand, really going from idea to funding to up and running and operating. It's groups like a Rev One that were really instrumental in us,
Did you reach out to them, or did they find you?
Yeah, so I reached out to them. I knew about Rev One here in the community over a number of years. So when it really came time to, really roll up our sleeves to go do this thing, they were, and I have some very strong relationships over at Rev One. So I reached out to them first to say, hey, I got something, I think. Let's go make this happen.
So a recipe for success is building those relationships already with the type of before you go and ask them.
Yeah, Alex, I will say that, just in general, I think always continuing to, grow your network and build those relationships across the board. And, having done that before starting DeepLens, I really think it really helped facilitate and optimize the process of going from idea to raising dollars to, operating. There's a benefit there.
For your first initial client, well, in this case, you have to have both the hospital and the sponsor. How did you overcome that challenge? Those first ones.
Yeah, no, and I think what's interesting about your question is the challenges were, going to both providers and the sponsors and saying, hey, look at this innovative, creative way that we're solving somewhat of an old problem, right? And look at how we're doing it. And I think why that was such a challenge is we saw the excitement from both the providers and sponsors on how we're solving, patient identification and early screening from the point of diagnosis and pathology, which folks were getting excited about. But then they'd say, well, where have you done it? Right. And when you're a new company and you're going out there and really trying to create that.
That's not the question you want to hear.
Right. That was really, I would say, one of our biggest challenges.
Mm-hmm.
But the way we overcame that is, and I talked about it a little earlier, just related to our lighthouse clients, was really our ability to partner with even pharma companies as well as providers out there that were really willing to allow us to trial the platform and really basically run it like a study.
Moving forward from this point,
yeah.
There's challenges probably and difficulties yet to face. What do you see in order to move the next year or two that you're going to need to overcome? What hurdles you're going to need to overcome?
I think, the obvious right now is just the environment that we're in, right? With COVID-19 and the coronavirus, it's producing challenges for everyone. So that that's first and foremost that I think we're all trying to overcome that, in this current landscape, right? The second is scale. I think scale, that's a good problem to have, by the way. But scale, we're constantly thinking about just scale of the platform. We're constantly thinking about scale of resources, because even as our data comes out and sees more positive results on how we're solving this big problem, we do, and excited about it, but we're going to have to be able to scale to run, hundreds, thousands of trials at, hundreds of institutes with many sponsors. I think we're a step ahead of that just with how we've architected our platform. With the ability to scale. But I think, those scale issues are always faced by, smaller companies and as they really grow. But I think, again, it's a good problem to have.
For you as a leader, how are you innovating? How are you growing? What books, audiobooks, podcast blogs are you reading and listening to facilitate that growth and innovation?
Yeah. So there's one specific one that I watch pretty heavily, and his name is Dr. Chadi Naban. I actually have known Chadi for a while and have a relationship with Chadi, but he does a podcast, and he's an oncologist, and he has some very fascinating topics with healthcare professionals, new technologies, but he does a fantastic job in his podcast of individuals and, just segments that he runs. I learn something new every time I watch one. So I would say that is a key one that I really lean on, and make sure I identify time to review that podcast. And, From Good to Great is a book that I think a lot of us know. But, even going back and looking at my notes and continuing to understand how, I would say the framework and specific criteria that you look at within that material, how can I kind of grade myself and the company as we move through that process. So I would say those two sources. And then the third is we really try to provide an environment, Alex, within Deep Lens that, whether it's just even in Slack or, even in, certain events that we host, providing the mechanism where no matter who you are, your role in the company, you can continue to share, whether it's ideas or even material or podcasts that you recently reviewed. So it's really facilitating through our company that constant innovation, that constant, hey, is there a new idea? There's even aspects of looking at contests internally where we can run within the company that continue to drive that innovation.
As a tech leader, last question I have for you. What kind of tech innovations do you predict we'll see in the near term, like the next year or so, and the longer term, about 10 years?
Oh, wow. You know, and if I, not that I have a crystal ball, right? I think we're going to continue to see more and more artificial intelligence and not just, you know, mathematical methods and models, but I think where we're going to see the innovation there is, you know, how can we take the sophistication in some of that math and really get it into workflows and put it at the fingertips of your knowledge workers and your experts. I think you're going to see some really cool innovation there. I think, you know, even if I advance on that, you know, robotic process automation, or RPAs, I think that's where, you know, this combination of that advanced mathematical models and looking at solving some of those tedious tasks to optimize workflows. I think we're going to continue to see advancements there. You know, when I really look at the problems that we're trying to solve, where I get really excited about, I think you're going to see a lot more, I'll say more in the prediction aspect, right? And to be more specific, where, you know, using a platform like Viper and techniques in AI like we have, being able to not only, you know, be able to identify and screen that patient rapidly and get them, you know, identified for a clinical trial, which we're solving now, right? But then being able to use predictive modeling to say that specific patient, they're going to be, you know, very successful on this trial because we've already predicted that from other patients that we've seen, right? I get really excited about that because that's really where I see things going, you know, in the next couple of years, in the 5 years. That helps both the providers. It helps even better clinical trial design on the pharma side that are designing those trials. So I think we're going to see significant advancement there. And why I get so excited about that is because it's the patient that benefits from it. All these things that we're doing from technology and math and process, and then, you know, being able to embed those techniques into the clinical workflows. I do believe that, you know, some of these examples are going to be realized, and if not already. So I do see that, and, you know, even into being able to basically run virtual clinical trials, which, you know, there's a lot of discussions and advancements there. So I think we're going to see some really exciting aspects, I think, year, 2, 5, 10. Because again, I think all of this even leads to, you know, smarter clinical trials. And in the end, we're talking about, you know, increasing cure rates and decreasing side effects for patients. So that again, I think there's a lot of excitement there.
Have you seen a company using AI, machine learning, or other technology to transform the way we live, work, and do business? Go to uptechreport.com and let us know.